Hi, I'm Rochelle Naylor, and I'm an assistant professor of pediatrics with a secondary appointment in medicine here at the University of Chicago, and I am part of the section of adult and pediatric endocrinology. I've actually been at the University of Chicago since 2005, having done all of my training after medical school here. So, my residency, a chief resident year, and then my fellowship. And I've been on faculty since 2012. My clinical interests lie in diabetes, and this includes monogenic forms of diabetes that I'll be discussing when I talk about my research interests. And it also includes the uptake of technology used for diabetes, in particular, the disparities that exist between racial and ethnic minorities' uptake of technology use, including pumps and CGM. I'm also interested in all things pediatric endocrinology. In terms of my research interests, I have been conducting translational studies in monogenic diabetes since my fellowship. So when I came, I knew that I had an interest in diabetes and I had an interest in genetics. And so the University of Chicago is the perfect place to be for such interests. So I have been working with Dr. Lou Phillipson and Siri Greeley and Graham Bell since my fellowship and continue to do so. And I've expanded my mentorship pool into Dr. Albert Wong and other people who I collaborate as well, all around monogenic diabetes. So these forms of single gene disorders are really a wonderful roadmap for precision medicine and how we can really use genetics to classify diabetes correctly, and that directs our management, improving outcomes. My work in this area has led me to participate in the University of Chicago monogenic diabetes registry, which is the largest registry of monogenic diabetes in the Western Hemisphere. And with this registry, I follow over 700 individuals affected by MODY, maturity onset diabetes of the young. And this allows us to really understand, first off, the barriers that people experience in trying to get this diagnosis, how best to manage these forms of diabetes. And it really helps us to understand what people living with these forms of diabetes need from us, what questions remain unanswered, and what they hope that we can contribute. I have in recent years also have been working on studies of atypical diabetes, and most specifically with RADIANT, the Rare and Atypical Diabetes Network. So this is a multi-center effort, and it hopes rather to push understanding of atypical forms of diabetes with implications for how we classify what we currently call type 2 diabetes and how best to treat people so that we can improve outcomes. The University of Chicago has a wonderful legacy of research in diabetes, and I have certainly benefited from this legacy. And I've also been delighted to be able to work with a number of both pediatric and adult endocrinology fellows who have been interested in monogenic diabetes, and I hope to continue to do this in the future.